Welcome to Get Moving TV. I'm Dr. Chris Landon and I serve as your host. Here in Ventura County, as always, there are some very unique things happening, certifications for health services that are really not available anywhere else in Ventura County. We have programs for the elderly in terms of exercise. We have fundraisers for events for children with chronic illness. This is just an incredible place for health. With me today, I have Dr. Patty, as she's known in her clinic in Mandalay Bay. To get to Dr. Patty is really quite an experience. She's very interested in children, how they relate to the family. But really, as they relate to the family, we begin with that very first nutrition. So Dr. Patty, who joins us today, tell me a little bit about yourself. Where are you working?
Dr. Landon, I work at Mandalay Bay Women's and Children's Medical Group in Oxnard, California. We're affiliated with VCMC. And I've been there for the last year and a half, and I love it. We just get to see all sorts of children there.
Well, Mandalay Bay Women and Children's Medical Group, it sounds like you have women and children all in one place?
Absolutely. We have obstetrics on site as well as the pediatric department there. And so I've been lucky to get to work closely with our obstetricians.
Well, our kids do grow up and have other children. Are there any other specialty services they have there, adolescent gynecology or anything along that line?
Absolutely. We have Dr. Breck Dosher, who does adolescent gynecology on site as well. And a new service that we've been offering is our breastfeeding clinic, which I run on Friday afternoons.
Well, it sounds like obstetricians are talking to pediatricians and really looking at that mother-child unit as that they actually belong together. A breastfeeding clinic, what goes into a breastfeeding clinic?
Well, for breastfeeding clinic, what we're trying to do is help support our women be successful at breastfeeding. Unfortunately, it's become sort of a lost art, and women aren't knowing how to do this on their own. And because it's natural, most people assume it's easy, but it actually can be a little challenging. And so what we've done at breastfeeding clinic is try to set up services where we can sit with mom and baby and work together on helping them get a good, comfortable position for mom, because she might be sitting there for a little while feeding baby, and getting baby to latch appropriately. A lot of women think that breastfeeding should hurt, and that's a misconception. So what I'm trying to do is help these women get their baby attached appropriately so that we can get good nutrition, good happy bonding, and hopefully keep breastfeeding going longer than what it currently is.
Well, it sounds like you think that human breast milk is made for babies, but what about formula?
Formula has its place in our field, and I think a lot of us should consider it more like a medication or a supplement instead of true primary nutrition. Breast milk is meant to be for a baby, and so I think too often we don't understand breast milk as providers. We're a little confused. It's hard to determine when a baby's getting enough, but it's easy to know when a baby's getting enough formula. And so I think too often we're shying away from encouraging our moms to continue breastfeeding, and we're going to that simple fix of formula.
Well, I know there isn't a meter running on the breast. It is hard to know sometimes. But usually this has to start in the prenatal period with just good teaching while women are pregnant, and that this is really something that's designed for human beings and needs support in the hospital. I know Bonnie Boulay, who's our nursing head of obstetrics there, came to me and said, Dr. Landon, we're spending so much money on formula, money that should be going for other services. And to really go to the doctors and say, unless there's a medical reason, gee, let these poor women have a chance to breastfeed. And I know we've gone through a certification process. What is that certification process?
We've become a baby-friendly hospital. There's a baby-friendly health initiative, and this is actually an international program. And not every hospital actually qualifies. You have to meet 10 rigorous steps, which include training for your staff, everyone having the understanding that breast is best for the baby, and that we don't want to be encouraging formula. In addition to the training, we're trying to get babies to breast for mom within the first hour, because studies show that a baby who latches more immediately is going to be a more successful breastfeeding baby. We also encourage our nurses and staff to avoid pacifiers and any other type of food, so even sugar water or water in general. We want to avoid that for the baby, so they're solely getting breast milk.
Well, it sounds like every hospital must be baby-friendly. What name some of the other baby-friendly hospitals in Ventura County?
There are none, Dr. Landon, and that's actually surprising because you would think that there'd be a devotion to breastfeeding. Because this is a rigorous testing, not everyone has pursued it, and at this point we're the only baby-friendly hospital in the county.
Well, if I were to breastfeed instead of bottle feed, how much money do people spend in a month on bottles, formula for a 1-month-old, 2-month-old, 4-month-old?
It could get pretty pricey, and it depends on how much a parent's actually feeding their child. And when you're doing breast milk, it's free. All you have to do is keep mom well nourished and well hydrated. And so sometimes there may still be cost for a bottle. Some women feel shy about breastfeeding in public, but they again don't understand that they can still pump and offer breast milk in a bottle. They don't have to turn to formula as an alternative.
I know in the hospital we have these the 2-ounce feeding formula, and we just want to, if we can just get that baby to take that whole 2 ounces down, we were successful. And how do you feel about that? I know we're having to send babies home so quickly. We really want them to learn to feed quickly.
Well, and this is a good point, Dr. Landon, because ready-to-feed formula, which is usually what's available in the hospitals, comes in 2-ounce bottles. This is about a 2-ounce bottle of milk, and this is what we're trying to give babies, and this is what parents are thinking they're supposed to give their babies. This is the size of a newborn's stomach, Dr. Landon. This is about 5 mLs or a teaspoon worth. 2 ounces is 60 mLs. So we have women who think they're supposed to get this much into their baby. As you can see, that's quite a lot of formula. Not only women who are thinking this, but family members who are pushing it. And I'm sorry to say, even some physicians who think this is how much a baby should be getting. And so this is part of what we're trying to work to get people to understand what a true newborn stomach size is. When they are going home, sometimes before day of life 3, that's a lot of formula. At day of life 3, this is what we're talking about. This is still less than an ounce. It's about 22 mLs of milk. Again, you can see that's quite a lot that these women are feeling pressure to feed their baby. And so it'd be nice if we could really help educate everyone, physicians and families, extended families, to really understand this concept that a baby's stomach is meant to breastfeed.
So it sounds like things start small, and as I know at Ventura County Medical Center, we must give out little wristwatches because the babies are fed every 4 hours. Is that how babies feed at home? They pay attention to time?
Absolutely not. And unfortunately, that's what a lot of our providers and women think, that a baby should be on a time schedule. Roughly, a child will start getting themselves onto some sort of feeding schedule, but for a breastfeeding woman, the most important thing for her to understand is that child should go to breast 8 to 12 times in 24 hours. So I think the misconception comes that if you do the math, that's every 2 to 3 hours a child should feed. With the breastfed baby, though, they'll have a lot of variation, and some women misunderstand a baby who wants to eat every hour, hour and a half to mean that they don't have enough breast milk. However, babies do something called cluster feeding, which means that they'll feed several times to kind of build up their protein level and then go into sort of a mini hibernation. Our newborns can have one period of a 4 to 6 hour sleep without that being concerning, as long as they're getting to breast 8 to 12 times. And that's something to really help women understand, because they panic. This child who's on breast every hour, they figure is starving, and then they open up that can of formula, and then they go to that and they get relief.
I know sometimes babies will also latch on and stay on for an hour or 2 hours, have exhausted moms, and tell them, well, you know, that's how babies comfort themselves is with their mouths. And they're not going to start smoking if you give it up earlier. But what are some of the benefits of breastfeeding? Can you name a few, and maybe the common ones in terms of it is humans made for human nutrition? And how about preventing diarrhea? And I know there's feelings about autism and some wilder thoughts as well.
Absolutely, there's benefits for both mom and baby. We'll start with baby because you mentioned that. Studies are out there trying to look at an autism link, and some studies are showing that there seems to be lower rates of autism in breastfed babies. The research is still ongoing with that. As far as diarrheal illnesses and otitis medias, definitely there's a decreased risk in children who are breastfed. Even children who get 3 months of mom's breast milk will have have reduced illnesses. Of course, the longer you go, the longer you get to keep that protection. The nice thing is moms are giving antiviral, antiparasitic, and antibacterial factors to their babies when they're breastfeeding, so they're kind of giving their first immunizations.